Speaking with Dr. Nolan Perez, CEO of Texas Digestive Specialists. Dr. Perez, how long have you been practicing medicine in the RGV, and what is your specialty?
I opened the practice in 2007. My specialty is gastroenterology. And so now we have a larger company. Over the last years, we've had a considerable amount of growth. And we've, first our company was called Gastroenterology Consultants of South Texas. A little bit long, wish I had a do-over there, but now we've rebranded it, and we have more specialties that we serve, and we're now a comprehensive digestive care group, and hence our name is Texas Digestive Specialists.
So where do you have offices? This is your new office in McAllen. You have other offices?
Correct, yeah, this is the grand opening of our new office in our surgery center here in McAllen. We have an office in Brownsville and a surgery center in Brownsville. And we also have an office in Harlingen and a surgery center in Harlingen.
What is special about this particular new surgery center here on Jackson Road in McAllen?
You know, what's unique here is we provide all of our service lines in one facility, and we also are able to do procedures downstairs at our surgery center. So, and as opposed to other places, you have the office in one location and a surgery center in another. What's unique about this facility, this state-of-the-art facility, is that we have our offices here for our gastroenterologists, our offices for our colorectal surgeons, and our offices for our bariatric and foregut surgeons. And then we have a surgery center downstairs where we can conveniently provide procedures and perform procedures for our patients.
In your remarks this evening, you said that Texas was around 45th on the number of physicians per capita, and you said the situation is worse here in the Rio Grande Valley. Can you speak to this?
Yeah, absolutely. So one of our missions is to try to, improve the healthcare of the Rio Grande Valley. The only way to do that is obviously to have more healthcare providers. And so we're recruiting heavily and trying to recruit more, at least in our specialist, our digestive diseases group. We're trying to recruit more physicians to bring more doctors down to the region. But yeah, absolutely. We have a really large population down here and not enough physicians. One of the ways, we provide effective and efficient health care to our region is not only by hiring and recruiting more doctors, but also effectively utilizing advanced practice providers, physician assistants, and nurse practitioners, many of them educated here in Texas through the UT system, through UT Arlington, of course UT RGV, and so we just hire them as fast as we can to try to provide health care to our community.
In your speech here at your new facility on North Jackson Road in McAllen, you also said the goal should be 99% of medical operations should take place in the valley. You said the medical community should work together to make that happen within your lifetime. Can you speak to this also? Absolutely,
yeah. I mean, it's just one of these aspirational things, I think, in our lifetime. Right now, Ron, because of the shortage of physicians and healthcare providers, obviously a lot of people either don't get health care or they have to get hospitalized to get their health care, or they have to go to big cities. San Antonio or Houston, are the two common ones from the valley where folks go to get their health care. Oftentimes that health care is delayed because it takes them a while to get referred there or to get seen by physicians there. And so, for me, I think that our beautiful Rio Grande Valley with the amazing people that we have here, we deserve to have the health care, provided right here in our community. So I hope that in my lifetime that 99% of, all of healthcare services can be provided right here. Why do I say 99%? Well, there's always going to be some things, whether it's heart transplants or different types of small bowel transplants that are just so highly specialized that they might require some huge quaternary, tertiary care facility. So that's why I say 99%. But it's really just the point I'm making is we deserve to have our own, services and the highest quality, most state-of-the-art, innovative types of not only diagnostic but therapeutic procedures and medications, provided right here.
And the last question about your speech here tonight, you said that you like forging partnerships that make an impact. Can you speak to this also?
Yeah, I mean, I think that nobody can solve the great problems, on your own. Some of the most difficult problems to solve, whether they be educational, healthcare, they require different types of stakeholders coming together. And so it's what I call a collective impact solution. And so when industry comes together, with, public schools, higher education, of course, all the different types of healthcare facilities, hospitals, nursing homes, ambulatory surgery centers, physicians in private practice. And so when you get all these types, of course, the university, School of Medicine, right? When you get all these types of people working together, city, county, government, when you get all of those types of folks coming together and creating a collective impact solution, we can really, really make a huge difference if we work together.
Yeah. Thank you. Dr. Perez, as a University of Texas regent, you would see the data on the state of the healthcare industry in the Valley. The region is growing fast and healthcare is the biggest industry. What would your prognostication be when looking at the Valley as a whole? Do we have enough healthcare professionals? What are the gaps? What challenges do we have with access to care?
Yeah, that's a great question. It's a loaded question. It's a good one. I think, and I'm going to answer it for you here in a second. I will say that probably I'm going to miss a few things that be a great question for Dean Hawker, a School of Medicine dean, that I guarantee you would probably give a much better answer. But I will say this: absolutely, you're exactly right. In this region, there are a lot of obvious things that come to mind. We still don't have enough primary care physicians, whether that be pediatricians, family practice, family medicine doctors, internal medicine doctors. We still are lacking in the primary care aspect. Some other things that come to mind: there's a huge need for psychiatry and mental health. There's a huge need for neurology and neurosurgeons. We are really behind the 8 ball in terms of providing great neurologic care. Also, when you look at other specialties like cancer care, really we have a deficit in breast surgeons, GU or urologic oncologists, and then GYN oncology surgeons. And so those are some really areas there that we don't have enough of, so they have to leave the area at MD Anderson or other places to get their health care. Even urology as a whole, as a specialty, we don't have enough urologists down here. So those are just, and then of course even our specialty, right? We don't have enough gastroenterologists down here. We're probably still about 10 or 12 too few gastroenterologists in the region, and also too few colorectal surgeons, too few bariatric and foregut surgeons. So across the board, there's just not enough. But I think the greater needs really are the ones I mentioned before, starting off with primary care, pediatric, GYN, OB/GYN physicians, not enough physicians to deliver babies. And then, of course, all the different specialties I mentioned earlier.
Anything else you would like to add?
I just want to thank you guys for what you continue to do to highlight great stories across the region. There's so many great things. I believe it's our time right now in the Rio Grande Valley. And finally, there's a lot of folks paying really good attention to us. A lot of amazing things are happening. I think the Rio Grande Valley is transforming right before our eyes. You look at the infrastructure changes. You look at the attention is being given. You have the University of Texas, UTRGV is growing so rapidly, the School of Medicine. You have now A&M coming down here wanting to do graduate medical education. You have A&M trying to support the Port of Brownsville. You have just anywhere you look, you have more folks wanting to do stuff down here, and it's just our time. LNG's come in, you have Elon Musk, investing more, and so I believe it's just our time to get it right. I've always said talent is universal, opportunity is not. So it's our job collectively as adults and professionals to make sure that we provide the opportunities for our brilliant young people that are born here and raised here. The talent's there. It's our job to create the educational and workforce and opportunities for them to achieve the American dream.